the spine surgery has sort of divided itself up into, there's pediatric spine surgery, scoliosis surgery. Then there's the people who do trauma and tumor work. I don't really do either of those. So I sit in the probably most popular part of spine surgery, which is primarily the adult degenerative wear and tear group. Now that can start as young as 15 or 16. Kids get injuries just like they get ACL injuries in their knees. They get spine injuries that are often amenable to very small, minimally invasive surgeries. And then you take that all the way up into patients who are in their 60s and 70s who have very complex degenerative, multiple spinal segment deformity problems. So my business, if you will, is pretty much divided between cervical and lumbar, the neck and the low back, 50-50. I definitely have tried to stay current, learning minimally invasive techniques, using advanced materials such as the Titan implant, and then stepping back and trying to measure, are the outcomes improving, which is one of the reasons that we do all this work with the research side of the equation. But my practice is pretty much a very typical community-based surgeon practice with an academic interest in the clinical outcomes research side. The easier quote unquote cases to tell a patient, I anticipate this exact recovery for you, are usually probably cervical, 1 and 2 level cervical cases, anterior cervical in the front of the neck. Most of those we can do outpatient or 23-hour stay, which is incredible nowadays. And most of those patients are almost fully recovered by 3 months. So, if you were to pick a procedure that is probably the most reproducible, most predictable, it would be the anterior cervical, either disc replacement surgeries or fusions. Those group of patients have a very predictable, generally, beginning and end to their recovery. The ones that tend to make the most impact, interestingly, from patients tending to feel the worst before they start and feeling the better, the delta, the difference between how bad they felt before surgery and how good they feel after, tend to be the lower lumbar patients, their lower back. So my favorite procedure with that is a very small anterior lumbar surgery, putting in 2 titanium Titan cages, and then through the back, the patient's still asleep, through 2 small incisions using what we call percutaneous fixation. We don't destroy the muscle. We just make 2 incisions through the skin and hook the whole thing up together through tubes, basically. So those patients feel the structural support of that surgery, the benefit nearly immediately. The surgery hurts for a while, but that pain gets better. But the lower back patients tend to be more disabled. They can't sit, they can't stand, they have difficulty walking. So the improvement that I see in those cases tends to be the most. It takes a little longer to get better, but they definitely are the ones that seem to be more disabled on the front.